I'm going to knock on the door, provide privacy. My name is Christy, and I'm going to be your nurse today. Can you tell me your name and date of birth?
Grace Workman, 7/1896.
Okay, I'm going to be doing your head-to-toe assessment today. And throughout the assessment, I'm going to be touching different parts of your body. Is that okay with you?
Yes.
Okay, let me wash my hands and then we'll get started. Okay. Okay, patient appears well kempt, clean, stated age, sitting erect, with hands to the side. Facial expressions are relaxed. Appears calm and cooperative for the examination. Okay, can you wiggle your fingers for me? Patient scores a 15 on a Glasgow-Coma scale. Do you know where you are?
Southern.
Do you know how old you are?
25.
Do you know why you're here?
Assessment.
Patient is alert and oriented ×3. Okay. Can you pull your mask down?
Mm-hmm.
Could you identify that smell for me?
Alcohol.
Okay. Cranial nerve 1 is intact. Okay. Could you take your glasses off for me? Okay, just look straight ahead. Pupils are equally round, reactive to light and accommodation. Okay, can you read this here for me?
95.
And this?
874.
Okay. Cranial nerve 2 is intact. Can you follow my pen light? Just with your eyes. Okay, eyes moved in coordination. Cranial nerve 3, 4, and 6 are intact. Okay, I'm going to touch your face with this cotton ball and you let me know when you feel it, okay?
Mm-hmm. Now. 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 Now.
Okay. Can I get you to clench your jaws? Okay, can you open your mouth to resistance? Okay, jaw strength is good and cranial nerve 5 is intact. Okay, can you smile for me? Frown. Puff out your cheeks. Raise your eyebrows. Okay, can you normally smell sour, sweet, and salty?
Yes.
Okay, cranial nerve 7 is intact. Okay, I'm going to come around to your ear and I'm going to whisper into your ear and you tell me, you repeat what I say, okay?
ABC. 1, 2, 3.
Okay, whisper test. Cranial nerve 8 is intact. Okay, can I get you to open your mouth and say ah? Okay, uvula and soft palate are midline. And I'm just going to check your gag reflex. Okay, sorry. Cranial nerve 9 and 10 are intact. Okay, I'm going to put my hands on your shoulders. Can you shrug? Okay. Okay, tilt this way. Okay, cranial nerve 11 is intact. Can you stick your tongue out for me? Okay. Can you say light, tight, dynamite?
Light, tight, dynamite.
Okay. Patient speaks clearly. Cranial nerve 12 is intact. Okay. Hair is evenly distributed. It is clean without any infestations. Skin is pink, warm, and intact. Can you hold your fingernails up for me? Nails are clean. The beds are pink. No sharp edges, and there's no clubbing noted. Okay. Your eyes are symmetric to the face. Eyelashes are distributed evenly. The sclera is white. Conjunctiva is pink. The pupils are 3 millimeters. There's no sign of redness or drainage. The head is symmetric, round, and normocephalic. Without any lumps or bumps. Any tenderness?
No.
Okay. I'm going to palpate for your temporal artery. Okay. Okay, 2 plus bilaterally. Okay, now I'm going to auscultate your temporal artery. Okay. No bruise noted. And now I'm going to palpate your frontal and maxillary sinuses. Any tenderness?
No.
Okay. And now I'm going to palpate your lymph nodes. You've got your preauricular, posterior auricular, occipital, your submental, submandibular, jugulo-digastric, superficial cervical, deep cervical chain, posterior cervical, and your supraclavicular. Okay. The external meatus is pink, warm and dry, no signs of drainage or redness. Okay, I'm going to strike this and stick it on top of your head, and you hear that evenly in your ears?
Mm-hmm.
Okay, that's the Weber test, yes. I'm going to strike this. Where could you hear that best at?
In my ears.
In the air or bone?
Air.
Air. Air conduction is greater than bone conduction. Nose is midline to the face. Skin is pink and intact, with no tenderness. Could you tilt your head back for me? Nasal mucosa is pink, moist, and intact, and without deviations or drainage noted. Can you occlude one? Breathe. For the other side. Airway is patent. Okay. The lips are pink, moist, and intact. Could you open your mouth for me? Okay. Your buccal mucosa is pink, moist, and intact. Your uvula and soft palate is pink and intact. Your gums are pink with no redness or swelling. Your tonsils are 1+, and you are without dental caries. Okay, I want to palpate your cervical lymph node. Any tenderness? Non-palpable, non-tender. Okay, I'm going to palpate your carotid artery. 2+ bilaterally. Now I'm going to auscultate your carotid artery. Okay, no bruise noted. Okay, I'm going to palpate the trachea. Any tenderness? Trachea is midline. Okay, I'm going to go back here. I want to check your thyroid gland. Could you tilt your head up and to the left? Okay, and now down. Up and to the right. Okay. Any tenderness?
No.
Thyroid non-palpable and non-tender with no masses. Okay. Can you move your head to the left and to the right? Okay. Hyperextend. Down. Rotate. Range of motion is good. Can you push against my hand? Okay. This hand. Okay. Neck strength is good. Okay. Okay, the chest is symmetric. Skin is appropriate for ethnicity. Can you take a deep breath for me? Okay. Chest rises evenly and symmetrically. Okay, I'm going to palpate for tenderness. Any tenderness?
No.
Okay. Okay, I'm going to hold my hands on your chest, and every time I move them, I want you to say 99 for me, okay?
99, 99, 99. 99, 99, 99, 99.
Okay, and now I'm going to percuss in all the lung fields. Resonance heard in all lung fields. Now I'm going to auscultate the lung sounds in the anterior chest. Okay. Okay, I'm going to just side this up. Okay. 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 Do the anterior sounds. I'm just going to start up here. Okay, breath sounds are even bilaterally with no crackles or wheezes. Okay, now I'm going to find the apical pulse, and it is the mid-clavicular line, the 5th intercostal space. Okay, 2 plus. Okay, and now I'm going to palpate for thrills, lifts, and heaves. Okay, no thrills, lifts, or heaves noted. Okay, now I'm going to listen to the aortic or the pulmonic, tricuspid, and the mitral. No extra heart sounds heard, no murmurs. And now I'm going to palpate the apical pulse for 1 minute. So,
You want me to lay down?
Yeah, lay down for me.
Okay.
Okay. Okay. I'm gonna put this right here, okay? Okay. epical pulse is 78, normal rate and rhythm. And when I listen to the aortic, pulmonic, tricuspid, and the mitral valve, the S1 was heard loudest at the apex, and the S2 was heard loudest at the base. Okay, you can sit up for me. Okay. The upper extremities are the same length. Muscles are distributed evenly. The skin is warm, dry, and intact. And I'm going to palpate for the radial pulse. Okay. It's 2 plus bilaterally. I'm going to palpate for the epitracheal lymph node. Any tenderness?
No.
Non-palpable, non-tender. I want to check the capillary refill. Okay, less than 2 seconds. Can you squeeze my fingers? Okay, extremity strength 5 plus. Okay, we're going to do range of motion. Okay, can you adduction, abduction, flexion, extension, rotation, range of motion full. Okay, your skin tartar is good. Okay, will you lay down for me?
Mm-hmm.
Okay, abdomen is flat, symmetric, non-distended. Skin is smooth and even. I'm just going to look for the aortic pulsations. And I don't see anything. I want to now auscultate for aortic pulsations. Okay, no bruise noted. Okay, and now I'm going to auscultate all 4 quadrants, starting in the right lower quadrant. Okay, vowel sounds are active in all 4 quadrants. Now I'm going to percuss in all 4 quadrants. Timpani heard in all 4 quadrants. Okay, now I'm going to use light percussion in all 4 quadrants. Any pain or tenderness?
No.
Okay, now I'm going to go a little deeper. No masses. It's non-tender. No pain. Okay, you go ahead and sit up. I'm going to go to your lower extremities. If you don't care, will you pull your socks off?
Yep.
Okay, limbs are the same size, symmetric. Muscles are distributed evenly. The skin color is appropriate for ethnicity. There's no varicosities or perforated veins. The skin is warm, dry, and intact. Capillary refill is less than 2 seconds. I'm going to palpate the popliteal. Dorsalis pedis. Posterior tibialis. Okay, 2 plus bilaterally. There's no edema noted. Could you, I don't know if they can see me or not, but push back on my hands. Push. Okay. lower extremity strength of 5 plus. You want to get up and do some range of motion exercises with me?
Sure.
Okay. Can you do, we'll just have to close together, adduction, abduction, flexion, extension, extend,
This ain't working.
ain't working, hyperextension. Okay, that's okay, hyperextension. Like that. Okay, rotate your ankles. Okay, range of motion is good. Okay, okay, I'm gonna place something in your hand while your eyes are closed, and you tell me what it is, okay?
Cotton ball.
Okay, sterignosis is intact. Okay, close your eyes. I'm gonna move your hands up or down, and you tell me which way they're going.
Up, down, up, down.
Okay, kinesthetic is intact. Okay, while your eyes are closed, you're gonna touch your nose like this, and then you're gonna alternate fingers to nose, okay? Okay, you can go ahead and sit down for a second. And rub your foot from your knee down to your toes. Okay, your cerebellar is intact. Okay, you wanna check your deep tendon reflexes. Oh, okay, they are brisk. Okay. I'm just gonna use this. Negative Babinski. Okay, could you stand up for me? Okay, I'm gonna move this to film you. Could you walk 5 paces that way? Okay, could you turn around heel to toe? Okay, patient's balance is intact. Okay, okay, could you bend over and touch your toes? Okay, checking your spine for scoliosis, kyphosis, or lordosis, and none are present. Okay, could you bend your knee up like this for me? And then back like that. Okay, deep knee bend is present. Okay, could you close your eyes and hands to the side for 20 seconds? Okay, Romberg test. You can open your eyes now. Okay, okay, can you twist from side to side like this for me? And then hyperextend your spinal cord. Okay, your range of motion is intact. And that is the end.